Hi, I'm Emily, and I coordinate the Climate and Health Program in the State of Oregon's Public Health Division. We're one of 14 states in the nation right now that has federal funding through the Centers of Disease Control and Prevention. It's part of the Climate Ready States and Cities initiative to study and plan for the human health impacts of climate change. And I'll be sharing a few resources over the course of my presentation that can be found on our website at healthoregon.org/climate change, and I'll also put that up at the end. So last year, we published our first report out of the state's public health division related to climate change. It's called the Oregon Climate and Health Profile Report. And it outlines climate projections for our state of Oregon and the associated health risks. Today, I'm just going to briefly give a summary of what's in the report, and you can find the full report online. And then I'm going to share a little bit about the actions we're taking both at the state level and in partnership with local health departments, and also share some resources that might be helpful in adaptation planning here in the Rogue Valley. So these are the key messages of our report. Climate change is happening in Oregon. Our health and safety are at risk. Some communities will be affected more than others, and we can work together to protect our families and our communities. We have an executive summary that accompanies these key messages and goes into more detailed points. And I wanted to point that out because we found that with some of our partners that this executive summary, which is just sort of this two-pager pullout, can be really helpful in giving supporting talking points for connecting climate change to health impacts and how people and communities are going to be affected as we move forward. And so these statements are based in the latest climate science and health research and approved, of course, by our state's public health division leadership. And so we've been using these pretty regularly as we go out and talk with partners. We also developed this infographic, which you can find online, and this is another communication tool that's really helped us to distill what can be sometimes a complex topic into one visual. And you'll see here that it starts with the greenhouse gases, moving into a change in temperatures, precipitation, acidification of our oceans, which all lead to different climate impacts. And we highlight 8 climate impacts in our report, which you see there. And some of them are pretty explanatory as to how they might affect our health, such as the first one there on the left, heat. We know that with extreme heat waves, it's pretty easy to understand that we might see more heat-related illness. And then there are more indirect impacts, which we kind of, at this point, pool into one big category, and that can include everything from, say, in migration, maybe an unplanned increase in population as we see people maybe moving from other parts of the states that are dealing with crisis and water shortages, or other issues such as the economic disruptions that might occur when we have crop failures. Those are just some of the examples, and you'll see that this infographic continues on down through those 8 impacts and lists some of the associated health risks that we considered. And this is by no means an exhaustive list, and even since putting this together, we found more things in the research. So this is basically all those that we were able to find support in current public health research and literature. And so some examples that you'll see here are, with heat, there's a relationship with an increase in air pollution. As we know, increased heat can increase ozone particulate, and harmful algal blooms can become more of a risk. With wildfire, we also see poor air quality, which can then lead to an increase in asthma, respiratory diseases. Another example is infectious disease, and similar to the challenges that we heard about earlier in terms of new pests or just increase in pests coming and affecting our agriculture, the same can be true with disease-carrying insects that are related to vector-borne illnesses such as West Nile virus, or Lyme disease is another one that we're looking at. So you can look more in depth if you're interested in seeing the research. You can use it sort of like an encyclopedia. Our report is something where you can look up by impact, or you can also look up by vulnerable populations that you might be most interested in or work closely with. So this morning, Phil Mote joked that he was the kind of doctor that doesn't do anyone any good. But we're actually starting to use Phil and his team's analysis of climate change models for our region to project the future burden of disease in Oregon. And it really helps to make the case for public health action that we hope will ultimately help to prevent injury and illness and save lives. So moving into some of the things that we're doing at the state, we have now an internal climate change work group. We meet monthly, and it includes now over, I think, 10 different programs are represented in this group. It includes environmental public health tracking programs, occupational health and safety, preparedness, surveillance, and epidemiology teams, the drinking water protection program. So you can see that climate change is really helping us to do some new cross-divisional collaboration that hasn't really been happening before at this kind of regular basis, where we're sharing data that we have, we're making connections about ways that we might be able to integrate climate change considerations more into our public health practice. One of the things that we were working on this summer was starting to try and understand more how drought is impacting our community health here in Oregon. And so we did a series of informational interviews with local health leaders in several different regions, and we put together a summary and a briefing for the governor's office. Another thing that we've been working on is syndromic surveillance, which is a pretty amazing system that really just came online this year. And so this was the first summer where we were able to look at real-time data that came in from our emergency departments. And so what you're looking at here is a graph of heat-related illness or heat-related emergency department visits over the course of this summer. And those spikes, are, not surprisingly, correlate with the heat waves of extreme heat that we experienced this year. So what we can do now with this syndromic surveillance system is start to pull information from our emergency rooms and be able to tell the story and kind of create a window into the health consequences of climate hazards. So this shows just days of exposure to extreme heat in counties, and you'll see that Jackson County and other southern Oregon counties were really up there in terms of the number of days that were categorized as extreme heat days, which normally by definition should be no more than 8 a year. We also look at air quality, and you'll see here that Medford and several other cities, but right here in Medford had quite a few unhealthy air quality days, and was probably one of the cities in Oregon that had the most hazardous air quality days. This is just from this summer, and so another way to look at that is the number of days that were less than good for your health, and that equaled a whole month here in Medford. So in the first couple of years when our program was just getting up and running, we worked really closely with 5 local health departments. And Jackson County was one of those. And the counties basically came up with local climate and health adaptation plans for their health departments. And they were some of the first local health departments actually to do this kind of work across the nation, really. And Susan Bezeau is here in the room somewhere. There you are. She was the lead public health planner on the plan here in Jackson County, and she has a wealth of information and is a great resource here for health-related actions that we can take as we prepare for climate change. And there's also a 2-pager summary sheet that she brought and is sitting out here that summarizes that plan. And you can also find it online through our website at the state's Public Health Division. So just to summarize a little bit of what Susan identified with her stakeholders and partners, in Jackson County, some of the impacts that rose to the top were increased temperatures, extreme weather events, changes in precipitation, and wildfire. And the related health impacts that they looked at were decreased air quality, increasing asthma, allergies, heart and lung disease, mostly related to wildfire smoke exposure, decreased water quality and quantity, potential contamination of groundwater, potential increases in water, food, and vector-borne diseases. And they also looked at mental health issues and social stress related to these climate stressors. Some of the things that they've been able to take action on since releasing this plan, there are flash reports that go out once a month from the Public Health Division or Public Health Department out to a pretty big list of partners that share the latest on hazards and outline roles and recommendations for appropriate response. And that includes guidance to schools in terms of recommendations for whether kids should engage in outdoor activity and what the emergency protocols are. So that's just an example of some of the actions to take. Unfortunately, public health in this state and in many states across the country, we don't have a lot of funding to do this work yet. So beyond my position at the state right now, we currently don't have funding to implement these plans. So we're crossing our fingers that some more will come our way so that we can actually take the plans off the shelf and really start to move forward on some of the actions outlined here. So based on those 5 local plans, we put together our lessons learned, and we started to develop a toolkit. And this is a work in progress, but it just recently went online. And it gives basic templates and lists of links and resources for public health practitioners and partners to start thinking about ways that we can prioritize actions. We also, through our preparedness program, offer pretty comprehensive emergency risk communication tools that are tailored by hazards. We also have the Oregon Smoke blog. This is another great resource for agencies to collaborate, aggregate information, and coordinate actions. A lot of our public health departments are finding this really crucial for keeping on top of smoke exposure. We also have something that's tracking harmful algal blooms, although this is not, it doesn't include all of the harmful algal blooms that are out there because we don't currently monitor our recreational waters as much as we would like to. So we know that there's a lot more that don't actually end up on this map, and that is actually similar to air quality tracking. There could be a lot more instrumentation that would give us more accurate idea. But so far there are tools out there that can give us a sense of what's going on. We also recently developed a social vulnerability assessment, and so you can find these maps online. And this is sort of a beginning tool for beginning the conversation around social vulnerability. We developed an index that is a composite of 9 different vulnerability indicators. They're demographic indicators, and you can then layer this map, which you can zoom in to a little bit more depending on which region you're interested in. And it can help you consider actions that reach vulnerable populations. It can inform planning around communicating risks and where we might want to focus efforts. Here in the Rogue Valley, there's actually a really great resource in terms of vulnerable populations planning the Rogue Valley Council of Regional Governments has a vulnerable populations committee that's been very active compared to other regions in bringing up these kinds of issues and thinking about how we layer our understanding around not just our environmental vulnerabilities, but also our social vulnerabilities. And then you can see here, just as an example, we could layer projections for our state with that kind of demographic, social vulnerability information to get a better sense of where our greatest human health risks lie. The other thing that we're working on this year that I'm really excited about is creating a statewide plan. So similar to the work that Susan worked on with Jackson County's health department, we're doing an exercise like that at the state level. So we're hoping that this plan will build off of the work of the Climate and Health Profile Report and really outline a set of recommendations and policy priorities that are actionable by our public health system and our partners. And part of what we decided in trying to determine what this plan is and what it should look like and what would make it a successful publication was that we wanted this plan to support the work of our community partners that's already underway. And our hope is that it's not just another plan that sits up on a shelf, but that it's something that could potentially leverage existing work and help to illustrate the alignment that already exists between a lot of different strategies and agendas that our partners have. And so we reviewed over 30 plans that were produced by different partner organizations. It wasn't a comprehensive review of every plan in Oregon, but it gave us a sense of what our other sector priorities might align with climate and health co-benefits. And from this exercise, we identified over 200 potential resilience strategies, and those will be combined with strategies that we pull out from research literature and also from stakeholder input. And that's about where we are in the process. We just have this pool of potential strategies, and then we'll be going through a stakeholder engagement process to narrow those down to our priorities that we hope to put in the plan by the end of summer. Related to this is a story project that we're also just beginning. We want to collect stories from across Oregon of projects that are already underway and those that illustrate actions that we want the public health system to be aware of, to partner, to support, maybe even lead, fund. And so we developed these community health resilience characteristics. And so we're looking for resilient stories that advance health equity and address social and environmental determinants of health, those that involve innovative collaborations, and projects that achieve both climate and community health co-benefits. So if you have any ideas for us, we're still looking for those stories out there that might meet most of those characteristics. So get a hold of me if something pops in your mind. The other thing that's on this graph that might be hard for you to see, but if you're interested in taking a look at it closer, this is just a part of an infographic that came from the RAND Corporation. It's R-A-N-D. And I really like this infographic because I think it does a really great job of differentiating between resilience planning and preparedness planning. And we have, I think, for a long time in my program, tried to figure out sometimes where that line is drawn. And what this says is that resilience is relationship-based. It's place-based, that every community has a different set of strengths. And with every year, we're learning more about challenges and opportunities before us that might require us to adapt and engage in adaptive management. And so it's less of a plan and maybe more of like a compass of how we know how we want to get where we're going, but not necessarily mapping out exactly where that is. So that building in that flexibility. And my other takeaways is that building resilience involves the whole community, not just solely led by government agencies. And that resilience planning prioritizes long-term investments and considers slow-moving long-term shifts in our environments, communities, economies, technologies, and culture. It's considered an ongoing practice rather than planning for a specific disaster or acute event. And that's important work that our emergency planners are doing and have been doing for decades. And so helping to differentiate there, I see resilience challenging us to not just focus on what could go wrong, but really focusing on what could go right and how to make that happen. So this is the strengths-based approach, and it helps us shift away from the doom and gloom and into the action and solutions. And in many ways, I find that we oftentimes spend a lot of time talking about our vulnerabilities and our risks, and not enough time studying and replicating the many diverse community-based solutions, some of which have been supporting human resilience in the Valley of Blue Waters for centuries, as David reminded us before the break. So before closing, I wanted to share some perspectives that we collected through a story project that we did earlier last year to support the Climate and Health Profile Project. So this was a series of perspectives that we collected from people from different backgrounds, different parts of Oregon, had held different professions, and it helped to supplement our more technical report. Warmer, drier climate conditions will impact the Rogue Valley immensely, since much of our domestic water comes from precipitation, mainly snowpack. And if we continue to experience major fires every summer, our health and economic livelihood are in jeopardy. And that was said by another outdoor recreation business owner who I think also leads rafting down on the Rogue River. Rising temperatures and changes in precipitation will likely result in changes in the distribution of disease-carrying insects. When food prices rise, the effects on Oregonians experiencing hunger can be crippling. Already forced to make tough choices between paying for food, rent, utilities, or medical care, rising food prices make those decisions even tougher. And that's the CEO of the Oregon Food Bank. I think that's a really important one, and that's one that we actually heard quite a bit, is this idea that climate change in itself isn't a risk. It's really a climate stressor that kind of is a risk multiplier. So it brings in that issue of justice and environmental justice, that those who are already experiencing the greatest vulnerabilities, where the disparities are the greatest, those we run the risk of those becoming even greater disparities. We are trying to preserve and restore first foods as they become further threatened by climate change. The salmon provide complete nutrition. They nourish our forests. Salmon is not just a food source, but a part of us and a part of this place. This is spiritual. We've done a little bit of partnering with tribal health departments across the state, and one conversation last week that just really got me excited about the types of projects that our health division is moving towards supporting. There is a project of the Klamath Tribe Health Department called the Restoration of the Spirit, and it's funded through the Oregon Health Authority, which is the agency that I work for, and I was just so excited to hear that there are these kinds of grants that are going out now to really have community dialogue around these issues in a culturally appropriate way, so that we're not determining exactly, how to get at the outcomes we're wanting, but really letting the community drive those projects. The worst thing on the horizon for mental health care is climate change and the economic stresses it will cause, falling disproportionately on those already close to poverty, where the vulnerabilities are the greatest. So this is a psychologist, and he's also the director of the Mental Health Integration Program in Salem Samaritan Health Services. And we've been surprised to find how many mental health practitioners are talking about this and are relating sort of the human nature connection that Eric was talking about earlier. And there's sort of this whole spectrum of both what is causing the problem and why are we having such a hard time getting a handle on the problem and getting to the solutions, but then also what are our reactions to the problem? How are we being affected? And I think it really depends on sort of the spectrum of where we're at, but it's definitely related to our mental health. And one great resource that we have here in Oregon is the Resource Innovation Group. And Bob Doppelt there with his team has started a new initiative called the International Transformational Resilience Coalition. And it's a coalition of people that are definitely working in the field of mental health, but also all across the spectrum in terms of interests and professions. And they offer quite a few free trainings and webinars. And could you say the name of that program? Sure, yep. So it's the Resource Innovation Group, and I'm pretty sure that that might even be their website is resourceinnovationgroup.org. I'm not sure, but if you Google that, it'll come up first. And they have done a lot of work on climate change and are now making the connection between climate change and what we're learning about individual resilience. And so resilience can be defined in so many different ways, and there's a lot of research that's coming out through psychology around what makes us personally resilient and how can we help to build individual resilience. And this work is really trying to challenge our thinking about how we scale that up so that we're building resilient organizations and that what are the types of actions we can take to build that social community resilience. And so it's called the International Transformational Resilience Coalition. It's kind of a mouthful. Building resilience is vital for all stakeholders, including medical providers, patients, healthcare leaders, organizations, and communities, since a true health system transformation cannot simply occur within an exam room. And I think this is really exciting for me too, because I come from sort of an interdisciplinary background where I have some environmental science studies, and then I went into public health and just sort of seeing where this all comes together, and that public health is really moving in the direction of understanding that our environments have a big effect on our health outcomes in terms of our built environment, our natural environment, what we have access to, and that healthcare providers are getting that and trying to figure out how do we go upstream to prevent some of these diseases that we're seeing in the exam room. So there's a whole public health modernization effort underway right now. There was a report that was passed through legislature, so there's a lot of work being done to sort of help redefine what it means to protect public health. As I think about the declaration of drought for our county and the storms across the country this past year, it's so critical that we think about our future and our children's future. The changes are happening as we speak, and it should be a call to action. That was said by Muriel De Laverne, who is the public health director of Crook County, and she was also very supportive in the climate and health adaptation plan that their health department did in Crook County. And it really is something that comes up over and over again as we move forward in this work, that it's really about collaboration, building public-private partnerships, learning that it's not a one-size-fits-all kind of problem. And so even, us at the state, we can't really necessarily give strategies that will be the best for the coast, and those same strategies won't necessarily be the best for the high desert. So it really is the think global, act local in action. So when I think about climate change, it's so easy to think about gloom and doom. but it's so much more motivating to think about it as an opportunity to come together and do things better. And climate change is really scary stuff, and the more I work in this field, the more I learn, the scarier it kind of becomes. But then I also see it really is a call to action, and it really can be a catalyst for change that we've known we've wanted to make, and now it's giving us more and more a reason and a call to come together and take action. And when I think about climate strategies, there are so many that we can move on, so many that have the potential to not just reduce greenhouse gas emissions, but while doing that, they will also improve our community health. Think about active transportation, eating more seasonal plant-based diets, planting more trees that not only mitigate flooding and sequester carbon, but also help keep our air and water clean. Our hope is that climate action can not just help us prepare for more frequent climate hazards, but that in the process we're improving our conditions and the systems that we live within, work, and operate within. And that when climate stressors hit, we're not just bouncing back to where we were before, but we're bouncing forward to something better. And now I just want to leave with a quote from Naomi Klein's new book and movie entitled, "This Changes Everything." What if confronting the climate crisis is the best chance we'll ever get to build a better world?